In this video, we're going to use Dexter to demonstrate placement of the mandibular premolar and molar PAs. But first, we're going to need to flip our instrument. If we were to try to take our mandibular PAs with an instrument like this, you'll notice the bar is facing into Dexter, and we don't want that. To flip your instrument, simply hold your bite block, slide your bar off and go over the bite block or over the rainbow, plug it into the other side. When you look through the ring, you'll no longer be able to see your entire bite block, so slide that ring towards you, flip it away from you, and slide it back on. You can now see your entire bite block through your ring. When placing this instrument for your mandibular premolar and molar PA, make sure that your bite block and phosphor plate are in between your tongue and the dentition. You're going to push this bite block midline and bring the phosphor plate as far anterior as you can to the front edge of the sensor hits the front of the patient's mouth. Make sure that you're parallel to your premolars and that your patient's entire cheek is around the bite block. Keeping it midline, have the patient bite down. You will now push your ring about an inch from the patient's face. Look at the end of your tube at your collimator to make sure the orientation of the square matches the orientation of your phosphor plate. Place your tube nice and flush with your ring and align your notches. When placing for the mandibular molar PA, you're simply going to make sure that that phosphor plate and bite block are in between the tongue and the dentition. And you're going to push that bite block and phosphor plate as far back as you can to ensure you get that third molar area. Again, your phosphor plate should be pushed midline and parallel to the molars, cheek around the bite block, like so. Push the ring in about an inch from the patient's face, checking that collimator at the end of the tube to make sure your square matches your phosphor plate. Tube nice and flush and align your notches.